welcome to your Wellness Wednesday. Of course, grieving, right, is a part of being a human. But the question today is, how do we know when that grief is morphing into depression? This is Sarah Stewart. She's a nurse practitioner with SSM Health. She's here to kind of explain the difference between the two and how everything is going to work. Good morning to you.
Good morning.
Okay,
thanks for having us.
Absolutely. First off here, Sarah, let's talk about those differences. Grief, depression, I'm guessing some folks can kind of maybe intermingle the two once in a while.
Absolutely. So some differences. Grief, there's often an identifiable loss, whereas depression, you may not be able to exactly identify the reason you're feeling the way you are. Symptoms fluctuate with grief, so those symptoms kind of wax and wane. Oftentimes people that have depression tend to be more isolated, whereas people that are suffering from grief exclusively tend to want to be surrounded by their loved ones.
Let's say somebody goes through a really tragic loss. You lose a parent, you lose a sibling, so on and so forth. Could that grief possibly turn into clinical depression?
Absolutely. So there's some risk factors for those. We often throughout our life experience grief, and there's some risk factors for those that it may morph into a clinical depression. Some of the main reasons that could be is people that don't have a good support system otherwise. It also could be people that have a history of depression and now they go through a traumatic event, a loss in their life, and suddenly that clinical depression resurfaces. So those are some big reasons that we have to be mindful, especially as practitioners and providers, that we're watching those patients that are more at risk.
And, Sarah, something that comes to my mind too is that, when you hear the term depression, I'm wondering if a lot of folks might think, well, I don't want to go to the doctor, I don't want to get on medication, I don't want to do anything like that. How can we manage, something like depression without having to get on meds, so on and so forth?
Yeah, so I think there's a lot of different ways that we can manage that. Definitely support groups, surrounding yourself with those that can be supportive to you. And I think we kind of have this idea that depression always needs to be treated with medications.
Right.
And that's not always the case. In SSM and palliative care, I work specifically with oncology patients. And because we know that depression can present as physical pain and other physiological symptoms, we have to tease that out and see if we can kind of solve those areas and in turn able to decrease their depression. Because with grief as well, so with grief, the loss is not always the loss of a loved one. In SSM and oncology, we see people that are grieving their loss of their identity as a result of their cancer and those sorts of things. So we have to really look at the whole person and make sure that we're treating all of the areas, which in turn could decrease the depression and maybe result in not needing medication.
Our time goes so quickly on this segment, but just quickly here, let us know what people can do if they feel like they need some help. Who do they reach out to? Yeah,
so there's lots of resources, in terms of obviously seeking emergent care if you're having those suicidal symptoms, and if loved ones are expressing that. But there's also many agencies in the Dane County. SSM Palliative is also in the community, so I think it's really important that let your provider know that you're struggling in these areas, and palliative care takes care of the whole person, which depression affects the whole person. So there's ways that we can help as well.
Hey, Sarah, thanks so much for being with us. We appreciate
Absolutely.
it. Good insight. Thank you so much.